Good evening, everyone. As you come in, we're getting started with our COVID-19 Safe Schools and Vaccinations for Youth tonight. Look forward to a really great conversation. I know there's a lot of interest among our community, especially about rolling out the vaccinations for our youngers, our 5 to 11-year-olds. But we have some really great experts on the call tonight. And we're going to get started officially in just a minute. We're still rolling in participants here, people joining the call. So again, welcome everyone. My name is Nancy Magee. I'm the County Superintendent of Schools. And I do want to say right off the bat that we're streaming live on Facebook. We're recording tonight. And we also have a Spanish channel with Spanish translation with our translator, Teresa Mendeville. Is Teresa with us on the English side?
Sí, buenas noches a todos. Esta es una reunión sobre el programa de vacunación de los niños y espero tener una muy buena conversación. Y a medida que vayamos hablando sobre esto, sobre las vacunas de los niños de 5 a 11 de edad, tenemos expertos fabulosos esta noche y empezaremos oficialmente la reunión dentro de un minuto. Estamos aceptando a los participantes, están llegando. Bienvenidos, mi nombre es Nancy Magee, soy la superintendente de las escuelas en el condado de San Mateo. Me gustaría comunicarles que estamos en vivo en Facebook y estamos grabando esta reunión esta noche. Tenemos traducción al español. Si por favor las personas interesadas pueden acceder al canal de español en la pantalla, en la franja de abajo, en el globo. Háganle clic para obtener la transmisión en español. Gracias.
Gracias, Teresa. And you'll head over to the Spanish channel now, and thank you. So we're really so fortunate tonight to have with us our San Mateo County Health experts that have just been exceptional partners for our schools in San Mateo County. This year, we have Dr. Curtis Chan, who is our Deputy Health Officer. Dr. Frank Trin, who's our supervising physician of communicable disease, and Dr. Anand Chabra, who's the medical director of family health and really kind of the vaccination czar in the county, right? So that's who we've got on the call tonight, and we're really interested and excited to have this conversation. One more housekeeping piece, and that is that you can log in questions into the Q&A on the webinar. We're not going to be attempting to answer every single question, but rather using those questions as a guide for what are the general trends in things that people want to hear about and want to know. So we'll try and pull information from your questions to guide the conversation. And again, my name's Nancy Magee. I'm the County Superintendent of Schools, and we'd like to know who you are. So we're going to launch a quick poll here, and this should be going out to you about who's in our audience tonight. We have nearly 400 people joining us, listening in tonight. Really curious to see who all of you are. And I'm going to be sharing the data in just a second here. In the meantime, Dr. Chan, do you want to make a few just opening remarks and introduce your team? And then we'll give the audience time to complete the poll, and then I'll share it before we start with the slides.
Great. Well, thank you so much, Superintendent Magee. It's been a great pleasure to be working with your staff and for our San Mateo County Health staff that have been working tirelessly throughout the pandemic, especially this year with so many teachers, school administrators, nurses that are in our 23 or 26 school districts, each of the school districts with countless schools it's been really an incredible effort of people working together, making huge sacrifices in their work. So really a lot of gratitude. So we're really pleased to be able to share what we've learned and give you some insights on what we're thinking about for the holidays and in spring of next year. And at the end, the County Office of Education has developed a survey, and we're very interested in your comments and suggestions as well. We promise that we're going to read all your suggestions and incorporate them into our communications, education, and policy making. So thank you, Superintendent.
Thank you, Dr. Chan. And as the superintendent, I'm putting out a every Thursday vaccination update that you might be receiving through your school community. And in that, we try to publish what will be the open spots this week for vaccinations for the younger kids. So we'll try and keep you updated every Thursday and follow up answering questions in the vaccination update that arise in tonight's conversation. So I'm going to go ahead and end the poll and share the results out. There, as you can see, of most of you are parents. So thank you, parents, for hanging in there tough with supporting your students and trying to keep your sanity all at the same time over the last 2 years. I really want to congratulate you for all that effort, but know that your kids have really gained incredible resiliency skills, learned so much by navigating through tough times. And I know it'll pay off as we go. So largely parents in the audience tonight, and a shout out to our students. We have 5 students on the call. So students, really happy to have you here. And I'm going to stop sharing now and we'll go ahead and get started. I think, I did share, right? Have another. Yeah, I already shared that. So this is a little techno thing. Okay, so we're going to go ahead and get started. Again, we're a month and a half, 2 months into the school year. We're making incredible progress in staying steady in school every day. What we're facing right now is the winter, which last year we saw around the winter holidays, quite a surge around COVID-19. So you're going to hear from the doctors and hear their expert take on how we're doing in schools and more about the upcoming vaccination. So Dr. Chan, I'll turn it over to you.
Great. Thank you so much, Superintendent. So we could skip to the slide and the slide after that about the main points. Thanks so much, Justin. So we have 3 main goals today for what we're going to describe to you. The first aspect is our actual goal of what we've been trying to achieve. And I think we've been really successful these first 2 months in San Mateo County. As you can see, schools, parents, teachers, administrators have been really all working together in really unprecedented ways. And I think by and large, we've kept students safe. We've kept students learning with very few examples of needing to quarantine or needing to close classrooms, particularly after the first couple of weeks. And, really important for me as a pediatrician and also a father of 3 children in the public school system in San Mateo County is that children are thriving as well too. And that wasn't always the case when school wasn't in session earlier in the pandemic. So again, really appreciate all that work. And, we understand that the risk of disease for children may not be very high, but the overall impact on public health and families of children is significant. So our goals are to limit transmission in schools, limit outbreaks, which Dr. Trin will describe, and limit the spread to families and thus hospitalizations and deaths. So the second main point is that we're going to be approaching a winter that's a little bit different than last year in that the Delta variant is much more transmissible. So that's the worrisome part. The fortunate part is that the vaccination rates, particularly amongst older adults, is excellent in San Mateo County. So that's going to impact our transmission, what we see in our epidemiology, as well as the prevention strategies we're going to implement or sustain for the holidays and into the new year. And the third main point is that we just like to outline that public health strategies have been very effective in preventing COVID transmission in schools. There's now good research and studies that have shown this throughout the nation. And our experience in San Mateo County from Dr. Trin and his team in communicable disease has shown that to be a similar pattern here in San Mateo County as well too. So the next slide. So this is a dashboard of San Mateo County that we have had on our website for the past 20 months. And it does really remind us of what we've endured. As Superintendent Magee highlighted, at this time last year, most students were in remote learning as we entered a most difficult winter, again, unprecedented in modern San Mateo times, when most of the deaths occurred, hundreds of deaths occurred. At this time last year, there was no plans for trick-or-treating and very little occurred, followed by strict guidelines that no visiting of grandparents for Thanksgiving and the holidays. And that was, much because we didn't have an effective vaccine at that time. So the risk to public health was extraordinarily high. So we recognize that that's a different case right now. The public health risk is much lower, and we really just need to get past this difficult winter. But as you can see from the data is real. We did lose 623 members of our San Mateo County community. As you can see from the death data on the right bottom side, the majority are over 70 years old. They're more medically frail, but they're also our grandparents and parents in our communities. And so we balance that with what we see on the left side of our data board, that there are a lot of cases amongst children on the left side. You can see those bar graphs of over 4,000 cases amongst children less than 9, 6,000 cases amongst children 10 to 19. So they cause cases and they cause transmission. But as you can see, pop backing over to the right side of the deaths by age groups, there's very few deaths that's caused by this disease. About just over 600 deaths across the nation amongst children 0 to 18. However, one thing that we're concerned about, it's caused thousands of hospitalizations, much more hospitalizations than flu actually in this past year, many folds much more. So this is still a extremely severe disease amongst older adults and those with medical conditions, and still could be a very serious disease amongst children as well too. So, my final comment about this slide is that, this dashboard is going to change, and it's going to be because so many communities children over 5 years old will soon be immunized. And the public health impact of a single COVID case is going to change as well too, because over 80% of our community is going to be immunized, and we'll have some herd immunity, some community immunity. So our country as a whole will probably shift again its public health approach, I would say probably in March or April. It'll shift to think about what is the best way that we can live and cope with this endemic disease that's going to stay with us probably for years. And we're going to have a lot fewer restrictions, but just again, a better and wiser way for us to live with this virus. And the next slide, please. So this is the case rates magnified from the previous slide. The major aspect to highlight at this time of year is the impact of the Delta variant. Again, it's highly transmissible, and it's causing high community transmission rates. and even some breakthrough cases amongst those who've been vaccinated. And that's the reason for the booster shots. And it's causing some hospitalization, and it's causing hospitalizations and deaths. And as you can see, and this is this whole large graph here dates back to April 2020. There was a surge in about July of last year, 2020, when we relaxed restrictions. And the case rates started to dip to about where we are now, around October 15th. And you can see that that's where the yellow arrow is. And at that time, that's when the winter surge of any virus, any respiratory virus, typically starts to increase. And that's what we saw last year. And there was this huge surge of disease, followed quickly by hospitalizations and deaths that really impaired the whole nation, and certainly our county here. Hospitals and ICU were really compromised and affected and threatened. And again, we experienced a lot of deaths. So that was in 2020, and you could see afterwards it quickly dropped in February and March, and towards April, the rates were much lower. And by June 1st, you remember, around at that time, we were in that low transmission stage. So it's possible to get to that blue level of low transmission, less than 10 cases per 100,000 persons for 7 days. So it's basically less than 10 cases identified per day in San Mateo County, because we have about 770,000 people living here in San Mateo County. So, but that's the time when we and our country and our state and county had more cases of the Delta variant. And that high transmissibility has caused this surge of cases in the last 2 to 3 months. And it's starting to come down. And as you can see at the very end of the graph, and we're starting to see this from data across the state, that it's coming down, but it's not coming down all the way nearly to the levels of June. In fact, we're concerned that it's starting to go back up as what we've seen last year towards the winter surge. So the second point, and these points will be shorter, is that we're probably going to expect this winter surge again, like any virus. But fortunately, compared to last winter, our high vaccination rates should protect us. So we'll have fewer hospitalizations and fewer deaths. However, the difference is this year, most of our kids are actually still in school, and our younger kids won't be vaccinated yet. So our collective goal across kids who are not immunized, but somewhat listen to us, and our older kids, many who are vaccinated, but may not follow everything we're saying, our teenagers, is our collective goal is to avoid the cases and exposures that not only would result in transmitting the virus to older adults, but for us, we do care that if there's lots of cases, that means that lots of kids are missing schools, they're missing youth activities, they're missing their extracurricular activities, their performances, their band program, their sports, their drama performances, and we don't want them to miss that. So that's the reason why we really want to keep cases low in schools. So because of this trend, we expect that we want to try to hold on to prevention strategies across the counties, in workplaces, and in schools through the winter. Largely, it's to get kids all vaccinated and to make sure that school continues its continuity. And finally, I think, sorry, Justin, maybe just go one. And I think our future state, again, nobody knows what the crystal ball would show in terms of viruses. But, we're hopeful that, by next year, we'll be back into that low transmission stage a little bit earlier. It won't be June 1st, or hopefully maybe it's March or April. And by that time, we're going to have even fewer restrictions than this year. So it is feasible to get back into that blue low transmission stage. Thanks, Justin. Next slide. So many studies by the CDC and researchers have established that prevention measures are effective. And we can also start peeling them back as our population gets vaccinated. So as more people have become immunized, the public health decreases. So some of the requirements that you see on the left side of the screen have evolved into recommendations. For example, the 6 feet social distancing requirement in the general public and in classrooms have been relaxed, but a lot of that is due to the masking requirements. Same as the small stable groups are no longer required, but these have more or less been incorporated into effective daily strategies that's going to prevent the virus as it becomes endemic with us in the following years. These are the concepts that, although they're no longer requirements, these are part of the process that we're surely going to learn about as parents, and as teachers and as administrators for the following years. The third point is that although the California Department of Public Health is currently still requiring masks and quarantine after exposures, they're likely also going to be continuing their modifications as well too. And you've seen this, that, for example, back in May, we heard the new policy from the CDC that vaccinated individuals don't need to quarantine. And exposures at schools, while everybody is wearing a mask, both the source and the contact is wearing mask, is considered low risk. So this qualified for modified quarantine of doing testing twice a week instead of excluding them from school. And these are variations that the state health department has taken that's different than the CDC to keep kids in school while also closely monitoring to making sure that it's not going to cause more infections in the classrooms. And again, what's emphasized here is that one important concept for people to understand, the biggest reasons why we want everybody to wear masks in indoor settings is they controls the source of the disease. You need tighter masks to protect yourself if there's virus in the air in the classroom. But if somebody is infectious and has a mild cough, if they're wearing a mask, it protects everybody else in the classroom. So in order for all these things to be happening, again, we realize that so much sacrifice and work has been done by the parents, the teachers, the nurses, and all the front offices in every school across the 26 school districts. So, and all of you have been collaborating with our communicable disease team, investigating every disease. So a lot of gratitude to you all. Next slide. So, although we review mountains of data, sometimes when we're trying to put together all this data real time in San Mateo County, it's extraordinarily difficult to have something that's scientifically valid and that could be used as a research study. So the CDC did conduct a research study in actually Marin County, and they reviewed an outbreak in June. And I think some of you heard about this or saw this in the news. And this was a second grade classroom that's really an experience that's typical across the country. And what they found, there was from one unvaccinated teacher who was mildly asymptomatic, who only pulled down her mask when she was reading with good intention to her students, infected 26 people, children and their contacts. And this was basically an attack rate of 50% of the students got infected. And this is an example of how infectious the Delta variant is. So, and I think the recommendations from this study and other studies that the CDC put together are these 4 strategies: wearing masks correctly. Dr. Chabra is going to talk about how we can get vaccinated if we're eligible. A really important concept that's going to stay with us for years is to really encourage and enforce that children stay home, and teachers also stay home if they have any symptoms, and to make sure that tests are routinely available for everybody. I think if we do these things, the bottom three things, we hope by spring that we'll be able to relax certain situations of wearing masks, for example. We may be able to relax some test screening. And so that by graduation ceremonies and end of year celebrations, I certainly hope that we'll have very low community transmission rates, similar to what we saw last year in June. And we'll be able to take beautiful pictures of our children smiling at graduation and end of year parties. So that's our goal, to keep them in school and make sure they're thriving and happy. Next slide. And just some really brief data just to point out for the scientists. I know there's many, many scientists here in San Mateo County that are parents as well too. And there's a lot of studies that are available. This was a particularly good one at the start of the school year in several counties in Arizona. And it showed basically that masks appear to reduce the likelihood of outbreaks in schools by over threefolds. So this is a particularly important study that's still guiding the CDC and the state health department this winter season. So I expect that we're going to continue to have mask requirements throughout the holidays for schools. Next slide. And the next two slides are going to be examples of how the CDC and the state and the local health departments are going to start relaxing restrictions. And you could see the CDC's, the National Centers for Disease Control's risk-based recommendations for screening tests. You could see once we get into the blue range, we're currently in the yellow moderate transmission area. Once we get into blue area, the CDC no longer recommends that we don't need to screen students for testing. I imagine something similar might be planned for masks as well too, at least masks for certain situations. And again, I just want to make sure that we're comfortable reading this and understand what moderate and low transmission rates are. Next slide. I think many of you have seen the news about how our Bay Area health departments have issued an indoor mask mandate. And we announced a few weeks ago about how we're going to relax the mask mandates once certain criteria are met. So, and what this is that there's basically three criteria. On the left side, the first criteria for no longer having the health officer order require masks indoors in public spaces. The first criteria is moderate transmission rates of less than 50 cases per 100,000. So we're there now, but we're there for like our first week and a half, and we need to be there for 3 weeks. The second criteria in the middle, which is now in the green stage, is hospitalizations are getting lower and they're pretty stable right now. There's not a lot of new hospitalizations, so that's been met. And the third aspect is to making sure that our community is immunized, particularly as it impacts the Delta variant. And the criteria that the Bay Area health officers chose was that either 80% of the total population is fully vaccinated, or 8 weeks after the vaccine is approved for 5 to 11 year old children. So just a quick rundown on what these dates are. On the left side, the first day that we were in the yellow moderate tier was October 14th. So in three weeks after that will be Thursday, November 4th, which is next Thursday. So the second criteria, so I explained the hospitalization seems to be met. And there's really two criteria for vaccinations. And this is, again, when people will be able to not wear masks when they're shopping, basically, other public places like workplaces as well too. So this criteria is about vaccination rates. As I mentioned earlier, the goal is to be at 80% vaccinated, and we're currently at 72.5%. We expect the vaccination rate is going to slowly increase in the next week, but it's going to start jumping upwards after children have an opportunity, young children have an opportunity to get vaccinated, which will likely be next Thursday, Wednesday or Thursday, November 4th. And they'll be fully vaccinated 3 weeks later after they get their second dose of Pfizer, which will be Thanksgiving, actually, Thursday, November 25th. And by that time, the percentage of fully vaccinated residents will start to increase rapidly towards the 80% threshold. The reason why we put the 8 weeks there, because we understand that some Bay Area counties may not get to 80%, or they may just defy the 80% logic together. In San Mateo County, we think this is a really important threshold, and our health officers is still going to strongly recommend that we wait until 8 weeks to make sure that all children get a chance to get vaccinated. So that's a priority for us. So the logic is that, again, the vaccine will be approved November 4th, and you wait another 3 weeks. So they may take 3 weeks for people to find the vaccine or have enough time in their schedule to get vaccinated or to decide to get vaccinated, to read everything about it. And it will take another 3 weeks to get their second dose and another 2 weeks to gain full immunity. So that's why there's a total of 8 weeks that we thought. So 8 weeks from November 4th will be December 30th. So we believe that, somewhere between Thanksgiving and probably closer to the new year, the health officer order for mask requirement indoors will be rescinded. And we're saying this as to help you plan for things. And, I think there might be a risk, for example, of going shopping at that time for children and older adults if they haven't received their booster shots or they haven't been vaccinated yet. This helps with some pre-planning in context of community risk. So those are my—
Dr. Chan, can I add in there about once San Mateo County reaches that threshold where the community, the public isn't having to wear masks indoors, it does not apply to school settings. So the California Department of Public Health guidance for schools requires masking on the school campuses. So that will remain unchanged until the CDPH determines that it would change that particular protocol.
Thank you for that clarification. That's completely true. School mask mandates are still going to be continued. So that's my last slide. I'm going to turn over to Dr. Frank Trin, who's an extraordinary internal medicine doctor, as well as an infectious disease specialist for our county for many years, and really grateful for his leadership of the communicable disease control team. So, Dr. Trin.
Thank you, Dr. Chan, and thank you, Superintendent Magee. Hello, everybody. So I just wanted to give really kind of an overview of the work and the scope of work and the collaborative work between San Mateo County Health and San Mateo County Schools and schools leadership and around keeping our children safe in school and in really preventing transmission and preventing infection and preventing kids in our community from getting COVID and getting ill. This slide really encompasses really the main points of what I wanted to convey, which is that first and foremost, that San Mateo County Health has really been working really closely with county schools at all levels, and just echo Dr. Chan's sentiments earlier. It's just really, I just want to give a lot of thanks to all of the work that everyone has done, and as part of their normal work and outside of their normal work. And really a great thanks, I think, and appreciation for all of the community, and because this is really a community, both for the schools and for the communities they serve and the children who attend, and then for us with County Health in really working with everyone. Second point, the classrooms in the county are closely following California Department of Public Health and CDC requirements and recommendations, and that's just a core tenet of that underlies all of the work and guidance. And really, as a result of that, we've just seen few transmissions identified within classrooms, and it's been the hoped for outcome, and so far that's what we've been experiencing, and along with that, I've seen very few outbreaks in schools as well. Primarily, most of the transmission that we've seen kind of around schools has been occurring in social groups outside of the classrooms and schools, and that's more of where the transmission's been seen, and as opposed to within the classrooms. And then ultimately, the preventive measures that Dr. Chan had been mentioning, these measures in the classrooms, these are the core to keeping school transmission low, and sustaining these measures is really going to be the key to continuing this path. Next slide, Justin. So to echo those preventive measures, this is from CDPH site. These are the 7 layers to keep kids in school safe, and these are really the core preventive measures that we've always come back to, and that's COVID-19 vaccination for those who are eligible, masking for staff, teachers, students, ventilation, hand washing, hand hygiene, testing, contact tracing, and then for any individuals who are sick, that they stay home, and that includes staff and students. Next slide, Justin. And then as far as the overview of the strategies that that are used in controlling transmission of infection, transmission of COVID-19, it's really, these are the core elements. So it's surveillance testing for individuals who would be at risk of infection, and these are primarily asymptomatic, non-symptomatic people. Testing of individuals with symptoms of utmost importance. Anyone who's symptomatic, you definitely want to identify them if they are symptomatic from COVID. Isolation of cases, and so there's always the difference between isolation and quarantine, and so isolation applies to those who are diagnosed or suspected diagnosed of have a suspected diagnosis of COVID-19, and that's what isolation would apply to. And then for close contacts to those cases, they would be the intervention is usually quarantine, or in the setting of schools and student contacts within schools, modified quarantine. And traditional quarantine would apply to close contacts who were contacted to cases outside of school. And then for those contacts that are within school, then modified quarantine would apply, which would result in the students still being able to attend class with testing and monitoring, as opposed to having to be excused from class. And then for the close contacts, the testing of the close contacts is also important to identify any new cases, individuals that were close contacts and ended up getting infected, in which case then they would have to isolate as a case. And then across the other major process with this is a contact tracing. And next slide, Justin. And so contact tracing here in San Mateo County, and this is not necessarily unique to San Mateo County. This is just a core public health disease control practice around COVID-19. So, but in San Mateo County, our contact tracers, the work that they do includes following up with individuals who test positive or who are diagnosed with COVID-19. The goal is to gather information to be able to give guidance around isolation and to identify individuals who may have been exposed or contact to that case. And then the confidential notifications of two individuals who may have been exposed as an extension of that and usually along with these processes, the team has been assessing for vaccination status as part of their information gathering. And then for the contacts, providing instructions around quarantine and other measures to prevent transmission. And then it's as an extension of that, another helpful service that the contact tracers and contact tracing team does provide for individuals in our county, both for cases, individuals who are positive, and for individuals who are contacts to cases. They can help with services to support those individuals to more successfully isolate or quarantine. And these services are varied. They can include helping them get groceries and meals and paying for rent, obtaining medication, and other critical needs. And so it's a service that the program and the individuals are able to do to at least try to help folks through the isolation quarantine period, which can be a real challenge. It's a real challenge to individuals that have to go through that. And then just want to highlight that the contact tracers, they are working closely, very closely with San Mateo County schools at all levels, from boots on the ground, individual schools, all the way up to the leadership level. And that work has multiple goals. And the primary goal, or one primary goal, is to identify students and teachers and staff who've made them exposed to a case at school, and then to help guide isolation guidance, quarantine, modified quarantine guidance, and then transmission prevention guidance for the schools. And then if there are multiple cases identified, to investigate them, and then to report outbreaks if they meet CDPH guidelines as an outbreak. Next slide, Justin. And I wanted to highlight the Pandemic Recovery Framework. This is a document that is it's really the joint guidance document with San Mateo County Office of Education, the Coalition for Safe Schools and Communities, and San Mateo County Health. And within this guidance, as you can see, it's just been updated the last few days. And a few days ago, it's continually updated. And within this guidance is really a lot of the granular information around guidance, including isolation and quarantine, and the algorithms for determining who would need to be quarantined, and so that guidance is all enclosed within this document, and it's continually updated, and is a reflection of the work jointly between county health and Office of Education in the schools. Next slide, Justin. And so with the work that everyone's been doing, and between the school contact tracers and the county health contact tracers and contact tracing team, fortunately, as I mentioned, we really have not seen we've seen very little in-classroom transmission, but there have been some scenarios that have been identified that seem to be more higher risk for potential transmission or transmission. And really the primary one has been social interactions outside of school. And that includes any kind of social gathering, parties, sleepovers, study groups. And it's really about interaction between individuals from different households, and if it has any opportunity for any inconsistency with masking and other preventive measures, then those interactions have been one scenario that has been seen. Prolonged bus trips without consistent masking has been another scenario that's been seen by the team. And then more of a potential is always, it's just the more mixing there is between classes and grades and individuals, then there's always the higher potential for those interactions to lead to transmission. And so these were some of the scenarios that I wanted to highlight. Next slide, Justin. And then as far as reporting and case reporting, I just wanted to come back to San Mateo County's Office of Education data dashboard, and the link is at the bottom of the screen. And from a reporting standpoint, I really appreciate the efforts from Office of Education around the data dashboard. Next slide, Justin. And so ultimately, just coming back to the key points that I started with, within the county, we've just seen few transmissions within classrooms and very few outbreaks in schools. And most of the transmission that we've seen has been occurring in social interactions outside of the classrooms and schools. And it just comes back to the preventive measures in the classrooms are working to keep school transmission low, and sustaining these is just going to be vital to continuing this, along with all the other efforts like vaccination and the likely upcoming vaccination for our younger children. And so the goal is just really keep going and keep maintaining safety for our students and keeping them in school. And I'm going to pass it on to Dr. Chabra around COVID-19 vaccines.
Great, thank you so much, Dr. Trin. And huge thanks to Superintendent Magee, to Dr. Chen, to Dr. Trin, and to all the County Office of Ed and Health Department staff who've helped put this together and make this webinar a reality. Next slide, please, Justin. So overall, we're doing quite well in terms of COVID vaccinations in San Mateo County. This is our dashboard. This is actually a day old, so we're actually a little higher than this, about 608,000 residents of San Mateo County who've received at least one COVID vaccination. And as you can see in the bottom left, about almost 93% of those folks have been fully vaccinated, which is great. And on the upper left, you'll see that of the 12 and over population, 90.4%, and I think today it was 90.5%, have been vaccinated. So that's of people eligible right now, which is the 12 and older population. And of course, I'll address the 5 to 11-year-old population in just a few slides. We do continue to see some racial ethnic disparities in COVID vaccination rates, but these have been shrinking over time as more and more people of color have been able to have opportunity to access vaccination through many different mechanisms. And so that's great news for the county and for the residents of the county. Our goal is that every racial ethnic group, every age group, every community in San Mateo County would have at least an 80% vaccination rate by the end of the calendar year. But of course, we'd like to be higher than that in all groups, but we don't want any group to have a substantially lower vaccination rate than the overall county population. And so a lot of our efforts as county health, as well as many healthcare providers in the community, are really around ensuring equity and access to vaccinations, and that continues to be a huge focus. As you probably know, vaccination opportunities for the general population are available, in many provider offices and clinics, at pharmacies. There are 61 pharmacies throughout the county that offer vaccinations. The county health puts on convenient standing community clinics, and then we'll talk a little bit about our mass vaccination site, which is now up and running again with the advent of the boosters. Next slide. So first, some information about COVID-19 vaccine boosters. So Pfizer boosters were approved at the end of September, and so those have been in place for just about a month now. Boosters for the Moderna vaccine were just approved at the end of last week. So that's a brand new thing and really started being offered probably Saturday, so just a couple days ago. Of note, the Moderna booster is a half dose compared to the primary vaccination series, whereas the Pfizer booster is a full dose, as is the Janssen booster or the Johnson & Johnson. And I'll use the term Janssen and say Johnson & Johnson because both terms are used. It's the same vaccine. For Pfizer and Moderna boosters, they should be at least 6 months after completion of the primary series, so after the second dose. And that's noted on the slide there. The following groups have been identified by the CDC and other advisory groups that they should receive a booster because of the relatively higher risk in that population. And these are people who are 65 and older, residents who are 18 and older, but live in long-term care settings. So either long-term care facilities, skilled nursing, congregate facilities for the disabled, group settings of any kind. And people who are 50 to 64 years of age with certain underlying medical conditions. And there are many lists of these easily found on the web, but includes things such as diabetes and cancer, but also pregnancy is identified as considered an underlying medical condition, even though obviously it's clearly a natural condition. And then the CDC identifies a group that may receive a booster. So these are slightly younger people, 18 to 49 years of age with certain underlying conditions, the same ones I mentioned, as well as people 18 to 64 at risk of COVID because of their occupational or institutional setting. So that might be somebody who works in retail and has a lot of exposure. It certainly would include teachers or anyone working in childcare or an educational setting. Could include people working with a homeless shelter or farm workers or correctional health workers. So because of these large number of categories that might be eligible, there's a good chance that any individual who's received the primary series could be eligible for a booster. And I think the main point around the CDC's recommendation and also California Departments of Public Health's recommendation on this is to ensure that the elderly and those in congregate facilities and those with medical conditions who are 50 to 64 really think about getting a booster. And that also includes people at risk for disparities based on the community they live in or the kind of work they do. And just in terms of the Pfizer and Moderna boosters, what has generally been found is people have the same kind of side effects from these that they would have from the primary series, usually at a similar rate or a little less. So you see basically the same side effects on this booster dose as you would for the first or second dose for Pfizer and Moderna. Next slide. The Janssen or Johnson & Johnson vaccine booster is recommended for all recipients 18 and older who received the vaccine. And this is recommended 2 or more months after their primary dose, as opposed to the 6 months for the Moderna and Pfizer vaccines. And again, the side effects for the second dose seem to be very similar to the first dose. And generally, as I think we all know, the side effects tend to be relatively mild. Some people don't have any, others certainly may have a sore arm, they may have some fatigue or some muscle aches or a low-grade fever, things that might mimic a low-grade kind of flu or cold symptoms. And then the final thing that was just approved at the end of last week were what I called heterologous booster doses, or mix and match, which is the more friendly name for them. So the mix and match boosters are allowed and can be used for any booster, regardless of what you had for the primary vaccination. So basically, people are encouraged, if they have questions about this, to talk to their primary care physician if they have one, or just, if they haven't read something or have a strong feeling that they want a certain vaccine as their booster, they can have that. There's no problem with having a different or the same vaccine for your booster as you had for the primary series. And one thing that there is some research that suggests, particularly for folks who have the Janssen or Johnson & Johnson single dose, that there may be a benefit for getting a Pfizer or Moderna dose as a booster. There's a little bit of research evidence on that. So that is a suggestion and a recommendation we're making locally. Next slide. So where can you get these boosters? As I mentioned, the the Moderna and Janssen were just approved at the end of last week. Initially, these sites were just providing Pfizer boosters. Now they're all adding on these other two. We do have the high volume vaccination site at the San Mateo County Event Center. This was launched in early October, or relaunched, I should say, in early October. So last week, in the whole week, we did about 2,000 doses. Today, we did 2,160 doses in one day. So the demand has gone up tremendously, and that's no doubt related to now there being 3 vaccines that people can get boosters for rather than just one. In addition, I mentioned previously the 61 pharmacies. We're also working with some of the pharmacies for them to do on-site booster vaccination at long-term care facilities. And then, many healthcare providers are certainly providing booster doses, smaller providers, as well as the county consistent community vaccination clinics. Right now, we're just offering Pfizer and Janssen there, but we hope to add Moderna soon. And then, of course, large healthcare systems like the Kaisers and the Sutters and community clinics such as the San Mateo Medical Center or Ravenswood Family Health Center or NEMS or Gellert Health Services. Many of these places are ramping up to provide boosters. So I think there will be lots of places to get these, but certainly we're having a lot of activity at the event center, and I think the pharmacies are probably getting a lot of it right now. Next slide. Now I'll move on to the vaccination of the young teens, and then after that to the 5 to 11-year-olds. So for the young teens, the 12 to 15-year-olds, Pfizer is the only product approved for vaccination for them. And this is still under emergency use authorization. And that's been in place for several months now. Because it's been in place for these several months, we have over 78% of 12 to 15-year-olds in the county have gotten at least one dose of the Pfizer vaccine. So we're getting close to hitting that 80% goal I mentioned earlier. And the CDC does recommend this vaccine for all young people 12 to 15 years of age, that they get vaccinated against COVID. The studies that the manufacturer did on efficacy showed at that time 100% efficacy. So there were no cases in the group that received the vaccine. Now, this was before the Delta variant, so the Delta variant certainly could change that a little bit. And the study was done on just under 2,000 teens. And certainly the reason, that a 12 to 15-year-old might want to be vaccinated, Dr. Chan mentioned some of these earlier, but certainly protection for themselves, but also for their family and friends, especially if they're around elderly folks, grandparents or grandparents, great-grandparents, folks who may be immunocompromised for some reason, they're getting cancer chemotherapy or something else, or they're around folks who are unvaccinated for whatever reason. And then again, for participation in the community, whether it's schools or sports or dance or the faith community, the kinds of things that we want young people to be able to engage in a healthy way. We have learned a lot about the interest of teens in vaccination, as well as some of the hesitancy through some work with the Centers for Disease Control and Prevention. They did do a rapid community assessment locally, and really, particularly in conjunction with the Mid-Peninsula Boys and Girls Club. And so a shout out to the Boys and Girls Club for their work with the CDC on that. And we have learned a lot from that experience. To the question, of side effects for the 12 to 15-year-olds, they're really pretty much the same as they are for adults. Again, pain at injection site, tiredness, headache, muscle pains, maybe a low-grade fever. Mostly these symptoms resolve within 2 days. It's also not uncommon for especially teens to feel faint, and have medical term being syncope, but to feel faint or actually faint. So care must be taken when the injection's being given, so that in case someone's feeling woozy, that they don't fall over, basically. One of the concerns that has come up, and is a very, very rare side effect, is that of myocarditis or pericarditis, and that's inflammation of the heart muscle or the sac surrounding the heart. Now, fortunately for the teens who receive the Pfizer vaccine and the small number who get this, it usually resolves without aggressive treatment, and the rate is quite low. So it's about 100 to 150 teens per million doses. So it is quite a rare event, and that's based on mostly on data from Israel and a couple studies from there. I'm trying to get my camera back on. Computer logged me out. Okay, there we go. So, that while there are these, rare, more serious side effects, vast majority of people have quite mild side effects from the vaccine. And next slide. So finally, the 5 to 11-year-olds, and of course, there's been a lot of excitement around that just now. Why are we even thinking about vaccination of 5 to 11-year-olds? And I think you heard a little bit of this, but there've been about 1.9 million cases of COVID in the US among 5 to 11-year-olds since the pandemic started. And that's those that have been identified. Of course, they're asymptomatic cases as well. So that's about 9% of the identified cases in the country. In this age group, we've also seen about 8,300 hospitalizations and 94 deaths. And this is federal data on the 5 to 11-year-old population. Now, those numbers may seem relatively small, but with a fairly healthy population, which the 5 to 11-year-old group is generally healthy, this actually brings COVID into the top 10 causes of death for 5 to 11-year-olds, because most kids are healthy. The other thing that has certainly been of concern, particularly in the pediatric community, is the condition called multi-system inflammatory syndrome in children. And this is, can be quite serious, and has resulted in some deaths among young children. So the CDC has identified 5,217 cases thus far of this syndrome in the US, and 46 deaths. And some of these children who may end up being hospitalized and do survive may have some long-term impacts from it as well. About half of the cases of this syndrome are in the 5 to 13-year-old age group. So that's just another of the reasons why people are really wanting to see 5 to 11-year-olds vaccinated. So the only product that's being considered for the 5 to 11-year-olds is the Pfizer vaccine again. They were really first out of the gate with their vaccine, and so that's why you're seeing approvals for Pfizer for different age groups before you're seeing Moderna and the Johnson & Johnson vaccine. The Pfizer product is 10 micrograms per dose, so that's a third of the adult dose. So it's a much smaller dose, and that was tested. They tested various levels, various dosages, And that seemed to minimize the side effects while still providing a good immune response. The interval is still 3 weeks, as it is for the other populations receiving Pfizer. And Dr. Chan had sort of mentioned our thinking about, why we think it may be 2 months before we reach that point that the Bay Area health offices had looked at. Because we want to give people several weeks to get vaccinated. They need to have a second dose 3 weeks later, and then not fully immune until 2 weeks after the second dose. So the FDA's advisory committee provided strong support for approval, emergency use authorization of this vaccine for 5 to 11-year-olds at their meeting yesterday. We haven't heard a final determination from the FDA, but I'm assuming we'll see approval shortly. And then the CDC's Advisory Committee on Immunization Practices meets next week, November 2nd and 3rd. And that's why Dr. Chan mentioned we might see full approval of this by all the bodies by November 4th or possibly November 5th. So I think we're really looking at the end of next week. I think it's highly likely that this vaccine will start to be available for 5 to 11-year-olds. The studies that Pfizer showed an efficacy of almost 91%. I put the confidence intervals there for the scientists out in the parent community there who are interested in that. And this is based on a study of about 2,200 young people. And this was when Delta variant was prevalent. So this is more indicative of a situation right now where Delta is pretty much the only version of COVID virus that's circulating. For the children, again, same side effects as you would see for adults or teens. Overall, they tended to have slightly less side effects than some of the other age groups, and that's probably due to a lower dose than the other age groups while still getting a great immune response. And in the study that Pfizer did, they did not find any cases of the heart inflammation, the myocarditis, or the pericarditis. Now, again, this was only 2,000 children, so it's not that it's couldn't happen, but it's encouraging to see that they did not find that. There was, I think, a couple questions that came in previously about one, folks who have an egg allergy. So none of the currently approved vaccines contain egg products. So being allergic to eggs would not be a problem for these vaccines. And there was another question about infertility and do the vaccines cause infertility? And there is no evidence of association with infertility for these vaccines. Many pregnant people and have received the vaccines. Many people have gotten pregnant and even delivered infants after this, and there has been no connection noted thus far. So I think we can, have some great confidence that it is safe in terms of fertility or future fertility for young people. And next slide. So this is my last slide, and it's about where we think you could most easily get the vaccine once it's available. So certainly check with your pediatric healthcare providers. Many of them are ready to provide the vaccine to 5 to 11-year-olds, and community clinics, like I mentioned, like Ravenswood or Northeast Medical Services, San Mateo Medical Center, are all ramping up to do this. Of the pharmacies in San Mateo County, 21 so far have indicated that they plan to vaccinate the younger children. So not every pharmacy will offer it. So please check, with the pharmacy or on their website if you want to go the pharmacy route, which is a good option. In partnership with the County Office of Ed and the schools, there will be some regional school-located clinics that will happen in the North County, Mid County, South County, and on the coast. And then we're, also ramping up to do that at the county-run community vaccination site, the consistent sites we have throughout the county, as well as looking at an option at the San Mateo County Events Center to do a sort of a special pediatric site at the event center to get a high volume of doses out in a short period of time. So all of this is, it's new. We haven't got the final word from the CDC, of course, but this is the planning thus far. And I think with that, that's the end of my slides, and we're happy to take questions. Thank you.
And Dr. Chabra, if we can go back to that, just that previous slide.
Sure.
On the school located clinics. So those will roll out on 4 school properties across the county, starting on November 17th. That first event will be in the San Mateo Foster City School District. Then on the very, did I say 17th? I meant the 15th, sorry, Monday, the 15th. And then the very next day, the 16th, there will be a clinic in Pacifica, and then on the 17th in Jefferson Elementary, and on the 18th in Redwood City. And those school-based events are intended to serve students or youth 5 to 11 years old all around the region who can get to that school site to obtain their vaccination. You do not have to be a student in the school. So these are regional sites to make it easier for people in neighborhoods. And we will be advertising this on the County Office of Education website. It will be available in our Thursday vaccination update. And then your school districts will also be putting out information about that. I did want to add one additional piece of information, because there's been lots of questions about mandates for vaccinations. And right now we're really focused on attaining the highest level of vaccination we can for our entire population, from the 5-year-olds to all the way up. And Governor Newsom has declared that vaccinations will be mandated for schools, and that will begin next school year, and we'll start with the older population, the high school population. So it will probably roll out over time. And in the meantime, individual school district boards can take action to mandate vaccinations in their local school districts right now if they wish to do that. I believe everyone's very focused on getting our younger kids vaccinated before we focus on the mandates, but those are probably into the next school year. So I think we have a lot of questions, mostly about, Dr. Chabra, a lot of questions just about the side effects and the long-term impacts on vaccination, COVID vaccinations. And I'm wondering, in the older populations, have we seen any kind of, you might have some short-term impacts of like sore arm and maybe feeling a little cold, flu-ish, which happens with the flu shot as well. But has there been any concerns about longer term impacts? I know you talked about the myocarditis, but.
Right. Yeah. I mean, one of the challenges, obviously, with a new vaccine is we don't have a huge amount of history. I mean, we have history going back to about December of last year, when the Pfizer vaccine first rolled out. So the things that have come up are the issue of blood clots with the Janssen vaccine, and that's particularly for women, and then the myocarditis and pericarditis with the Pfizer vaccine. There's also a neurological syndrome called Guillain-Barré syndrome that is, has been identified, and that's folks recover from that, fortunately, which is great. But it has been identified, and particularly I think around middle-aged men with some of the vaccines. And then, of course, particularly with the Pfizer and Moderna vaccines, initially, we also heard about anaphylaxis, so a severe allergic reaction. Again, a few cases per million doses. And that's why we have the observation period after the vaccine, so that if that kind of response happens, people can get the appropriate emergency treatment and then those symptoms resolve. So that's why we do the 15 or 30-minute observation afterwards. But aside from those, there aren't other longer-term significant consequences of the vaccine that have been identified. Obviously, if they are, then CDC will put out an announcement and this will be shared. And this is why there is this whole vaccine adverse event reporting system. So the VAERS system is really about capturing any kind of negative event after vaccination, whether it's actually caused by the vaccine or not, so that, it's casting a very wide net to identify things that may actually be associated with the vaccine, like the myocarditis issue.
That's great. And I know we're going to close here real quick. I think one very quick question that you could probably answer, and then a final thought just about the big picture. And if you were speaking to a parent of an 11-year-old, where the pediatric vaccinations are lesser doses, would you recommend that a parent of an 11-year-old wait until their child turns 12 and get the full dose, or would you recommend go ahead and get the pediatric dose?
Yeah, I would go for the dose that's appropriate to their age group. So get the pediatric dose at 11.
Mm-hmm.
Their second dose, if they turn 12 in the interim, the second dose then will be the higher dose. I think we want to go with the science as much as possible and what the research has shown us. And so while we're learning as we go along, we also want to make best use of the science we have.
That's right. And so just to close us out, we've had over time been able to eradicate disease because of vaccination and extended the lifespan, of our, population drastically, partly because of vaccination. So when we're thinking about vaccinating younger children, 5 to 11, part of that is about reaching immunity in the community so that no one is spreading at the rate of danger. Would that be true? It's not just about the individual health of the child, but also about community immunity. Is that correct?
Very, very much so. And I said that more around the 12 to 15-year-olds, but certainly very applicable to the 5 to 11-year-olds. In general, they may have mild illness, but their great-grandfather or great-grandmother could die from it. And so we really want to protect the community as well as the children.
Great. And so the other thing we're really looking to protect is the consistent and cohesive education of our children. So getting them back into school all day, every day in safe conditions for both teachers, students, and volunteers and everyone in the school community is a huge priority. San Mateo County has been able to be back full-time in school in every district, in every private school this year because of our partnership with all of you, Dr. Chan, Dr. Trin, and Dr. Chabra, and with San Mateo County Health. So with your guidance and expertise, we've been able to navigate some really, really tough times. And under all of that, kids have been able to come to school and connect and play with each other, see their friends, interact with their teachers, get the kind of support from adults that they need. And for that, I am deeply grateful. So thank you all for being here tonight. We're going to sign off, and we look forward to a COVID-free holiday season.
Thank you so much. And I think there's a survey that people can fill out too about.
Yes, please. And thank you, Superintendent Magee. And there's I think, more than 100 questions, and we couldn't get to them all. All the questions, whether they're, some of them are great and some of them are very provocative and thoughtful. We like those questions here in San Mateo County. And, there's a lot that we would like to clarify from education perspective, prospectively. So we can't answer all of them today, but we do appreciate them. And please do feel free to fill out the survey, and we do read all of them. So thank you.
Great. Thanks to our support team, Justin Watkins, Patricia Love, Anton, Teresa Mendeville, our translator, Melissa Ibarra, and our whole team, County Health and San Mateo County Office of Ed. Thanks, everybody.